Everyone. I'm happy to be here tonight, and I'm going to be tag teaming this presentation with Michelle Starratt, who was we were partners in developing this funding proposal for the unincorporated county. It's a wonderful opportunity to get new investment in the unincorporated county, especially at a time when we desperately need it. And so Michelle is going to lead us off.
I also want to say thank you to the supervisors, because this is an unprecedented amount of money. We've never seen this much money before. And as we went through the proposals and tried to craft a plan that met as many needs as possible, we saw that even though this is an unprecedented amount, it's really not as much as this community needs. So, more will be an important, it would be helpful to get more, is what we're going to end on, I believe. Next slide. So as many of you know, President Biden passed the American Rescue Plan Act in March of 2021, and that included about $324 million to Alameda County. There were a lot of goals within that act, and we've listed them here, but it was really a response to COVID and an expectation that it would help communities recover, hence the Rescue Plan Act as the name. These are some of the high need items that the Act identifies as what's eligible. In the interim rule that we saw that first came out in May of 2021, most of these things are listed, and in the final rule that came out in December of 2021, we see that there are additional things that you could link up to and find a way to make eligible. But these are really the hard hit items that they clearly state are eligible uses. Next slide. My Invoice is a local group that advocated really strongly for the unincorporated county. They began their campaign in the fall of 2020, and they held multiple meetings with Supervisors Chan and Miley. And they proposed that out of the 324 million, that 100 million come to the unincorporated county. And they were very adamant that there needed to be resources. And so through their efforts, and I want to lift them up and make sure everyone knows how vocal and how hard they advocated for the unincorporated county. And I think we can generally say that because of their hard work, we do have $14 million that the board has set aside for the unincorporated county. My Eden Voice held a general membership meeting on February 12th, and I went and presented this plan to get more feedback so that I could share it with the Board of Supervisors. And really the key themes over and over again, affordable housing is a constant concern. Housing services, meaning legal aid for tenants in multiple languages, access to mediation services, real concern around job training and resources for entrepreneurs to start small businesses, low cost financial services. Check cashing is the one thing that we heard over and over again, but also pathways to home ownership, financial counseling, credit counseling services, youth services. We heard a lot of need that the youth need things to do, and they need places to go, and they need job training as well. Mental health services is a key concern of the community. Childcare centers are a key concern of the community. Small business aid is a huge concern. We see a lot of businesses closing, especially those of low income members of our community. And then a community resource center, a place where people can go and have co-location of services, the ability for people to go to one place and get access to many things. If you think about a grocery store, check cashing right next door. If you think about going to the doctor, having public benefit navigators right there. If you think about going to childcare, having, a housing resource center right there. So being able to co-locate things came up as a real key concern. Next slide. So the Board of Supervisors in September of 2021 authorized the $14 million, and they really wanted it to be there to assist those hardest hit by the pandemic. increase access to services for basic needs, increase equitable outcomes for people of color and extremely low-income folks, improve the support systems, and provide economic relief to businesses from COVID. And so those were sort of the general goals of that $14 million. Next slide. I think, there we go. There's other resources besides this $14 million coming to the unincorporated county through the Healthcare Services Agency. Oh, sorry, wrong slide. I'm saying the wrong thing. So the Board of Supervisors took public comment in August of 2021, and there was a lot of folks that were submitting. Matter of fact, I think the supervisors will remember that there was $1.3 billion worth of requests for $324 million. So after all of those requests came in, and Eileen and I looked at all of them, and we both listened to the 14 hours of testimony as well. We met with My Eden Voice, we met with the Castro Valley Eden Area Chamber of Commerce, East Bay EDA, we met with the Ashland Cherryland Basic Needs Committee, or our staff did. We met with First Five. We met with the Workforce Development Board staff and staff from districts 3 and 4 to come up with, what we were hearing as the highest needs in the community, as well as what is eligible under ARPA, because ARPA has very specific goals and objectives. Next slide. Then this is the next slide I was about to say. This is the 14 million is not the only money that's coming in. The Board of Supervisors also authorized funds to the Healthcare Services Agency, and they're going to be giving funding to the Tuberculo Vasquez joint venture, which includes partners, Eden United Church, Ruby's Place, Hard, and Cadango, and then La Familia is also going to receive some funding for RCD, Village Connect, Eden Church of Christ, and Regional Pacific Islander Task Force. And so these folks are also serving the unincorporated county with healthcare related issues. So we just wanted to make sure folks knew that it wasn't just this $14 million that was coming to the unincorporated county, and that these agencies have already been selected and are providing services. Next slide. So the community engagement, key themes continue to emerge in all of our conversations. And I think I touched on this in an earlier slide, but this is another summary of what we heard from the community, both in letters and emails that came to Eileen and I, as well as the meetings that we'd held with those different agencies. Next slide. One of the things that ARPA really talks about is also the qualified census tracts. Now, we can provide services throughout the unincorporated county to low-income folks, but in this qualified census tracts, which we've highlighted here, we don't have to check for income. So if you live in any of these zones, your income doesn't have to be checked. But that's one of those qualifying rules that Eileen and I will be very carefully checking and tracking in the programs that we will be running. For the most part, though, we expect to do income qualifications for a lot of the programs in order to qualify for ARPA. Next slide. So we really gave a lot of thought to equity, and the board was really concerned about equity. And we came up with a statement that is an equitable community is where all residents have equal or equivalent access to goods, services, status, rights, powers, and amenities. And so we are really focused on making sure that is one of the goals, and that we are explicitly naming racial equity as a goal, that we are prioritizing deep cross-sector high impact investments for these funds to create long-term change. And, a good example of that is community bank, affordable housing, or childcare. Those things will have a long-term impact on the community. And we want to engage the historically underserved communities and prioritize investments to those areas. And we really want to prevent displacement of both residents and businesses. Next slide. I'm going to turn it back over to Eileen to go over the proposed spending plan. Eileen, you're on mute.
Sorry about that. Thanks, Michelle, for segueing into our proposed funding plan for the unincorporated county. And you'll see as we go through the presentation that my shop was really looking at the small business assistance and kind of related items. And Michelle was looking at the other community service, affordable housing. And so we're going to both be talking about those things as I go forward. And ARPA definitely has a different approach for qualifying assistance for small businesses versus households. So you'll see a little bit about that, different criteria. So to summarize the $14 million allocation, we have $535,000 for a community bank or low-cost financial services. And these would include financial literacy, non-predatory check cashing, commercial lending, lending circles, and we expect to issue an RFP to seed a program that could come into the unincorporated county and serve all of the unincorporated county with the goal of it becoming sustainable. Michelle is going to be covering these other programs: proactive rental inspection and registry, $1,140,000. Home repair programs for rental units, $2,575,000. Workforce job training program for $1 million, and this would be a partnership with our Workforce Development Board to create training programs, workforce and training programs specifically for the unincorporated county. We know there's programs in place already, but these would be tailored and curated for our community. And then $2,225,000 for small business grants, facade improvements, and small business assistance. This package of funding will again be allocated $1 million for small business grants in partnership with the East Bay EDA, a facade improvement program specifically for those qualified census tracts, and then small business technical assistance to the unincorporated county. Capital development for affordable housing and childcare and other capital development RFP for $3 million and a community services RFP for $3.5 million. A little bit about equity and funding distribution for the business assistance. As I mentioned earlier, that the funding would be available to all unincorporated county COVID eligible businesses, and the small business grant funding that we're proposing in partnership with East Bay EDA would be geographically based. So we'll be, just as we did with the CARES funds, we put a bit of a fence around the EMAC zip codes, which are those zip codes that make up Ashland, Cherryland, and San Lorenzo, and were the zip codes identified with one of the 5 hardest hit communities in all of Alameda County for COVID. So those communities will be protecting funds so that they can get access to them. We found that true to be with the CARES funding, that our businesses in Ashland, Cherryland, and San Lorenzo had a little bit of harder time accessing our program. So we'll be setting aside their proportionate share. And again, the funding will be available countywide. The facade improvement program is going to be targeted to qualified census tracts with a focus on Ashland and Cherryland as one of the hardest hit communities. And this is a program that we hope to we will propose to focus on landlords and commercial property owners who haven't been able to rent their space. Our current facade program doesn't currently allow for sort of speculative improvements on their space, and we want to make funding available so that space can be rented, and we hope to match that space up with these new service providers that are coming to the community. We want anyone who's providing this small business service to have a physical office and a staffing presence with language proficiencies in the EMAC community, with an emphasis on Ashland and Cherryland. And again, we're going to market and outreach our assistance, especially to those qualified census tracts that you saw on the map, which are throughout the unincorporated county. There's some in Castro Valley, Ashland, Cherryland, San Lorenzo. So as I mentioned, the equity and funding distribution for the other programs is a bit different. The small business assistance isn't income-based, but the household assistance is. So Michelle's programs will target extremely low and very low income households throughout the county. So it doesn't matter where you live, but if you're eligible, if you have eligible under these criteria, you'll be eligible for the programs. New services would be established in Ashland and Cherryland with a focus on co-location or multi-service center, again, for the influx of new services that are coming to our communities, both for the households and for small businesses. We want to see them physically in our communities providing services. Just a little more detail on the small business assistance. $1 million grants, the programming or the planning for the grants is proposed to happen this spring with East Bay EDA. We don't have the program designed yet, but probably will be similar to our CARES grant program, which was $5,000. The amounts may be different, the criteria will be different. But again, it'll be focused on, again, this would be for our unincorporated community. $750,000 for small business technical assistance. This money will be distributed through contracts. We'll be doing a request for proposals and we'll be selecting probably at least 3 providers of this service. And we're looking at small business assistance, entrepreneurship, capacity building for our nonprofits in this community. And lastly, the facade improvement program. And the RFP will be, a public process that folks will have access to finding out more information about. The community bank was brought up many, many times. And so we have a budget allocated for the development. And this isn't the Community Bank of the Bay. It's really a nonprofit service, small c, small b community bank that would focus again on financial literacy, non-predatory check cashing, lending circles, personal and small business loans. And we'd like them to be located in the community. And lastly, $1 million for job training. We'll be working with our Workforce Development Board partners. They administer millions of dollars of job training programs, and we'll be partnering with them to design programs that suit the community. So there'll be more meetings and work around designing that program as well. And Michelle.
So there are several, and that number is wrong, sorry, at the top there. There are several programs that have to do with housing, because housing was over and over again one of the highest talked about and requested issues whenever we talked with the community and got emails from the community and had those meetings. And so many of you know that we've been working on a tenant protection package. One of those ordinances is the rental inspection and unit registration ordinance. And if the Board of Supervisors adopts that ordinance, the fee that would be associated with that ordinance would not start for over a year. And therefore, during the first year of implementation, funding to jumpstart the program and cover the staffing and programs would be set aside from these funds in order to make sure that happens. If the ordinance is not adopted, we would move these funds, this 1.1 million, it's 1,140,000, to the capital development RFP and augment that program instead. And so that would be our goal. But this program is one that we've heard for the last 2.5 to 3 years is hugely needed in the community from the tenant's perspective. There's also another side, which is there's a lot of landlords who are not interested in this program. So again, the ordinance has not been passed, and that's not what we're discussing tonight. It's just the set aside of funds should the board adopt this ordinance. Next slide, please. We are putting aside money to do repairs in rental units. And we've been hearing from the community that there are huge rental concerns and that there are a lot of units that are in poor shape. We're also hearing very clearly from landlords that because of the eviction moratorium, many landlords are not getting paid. And so we're looking at a grant program to help landlords repair units. And this program will actually be run by Healthy Homes. It will be modeled after an existing program that is for homeowners, low-income homeowners. It's called the Minor Home Repair Program. And the idea here is that if there are significant issues within a unit, the Minor Home Repair Program will come on out, inspect the unit, work with the tenant and the landlord to come up with a scope of work that will repair the unit, and there will be a grant made and a contractor will be hired to create or fix the problem. And so this program is both funding to cover the cost of the contractor doing work, as well as some staffing for Healthy Homes. And Larry Brooks is in charge of Healthy Homes, and he wasn't able to be here tonight. So I'm speaking on that program on his behalf. Next slide. We are expecting to put out $3.5 million for community services, and that's new community services. And the idea is that we want to, lift up and create access to things that the community really needs. The items that are listed here, legal aid, housing education and outreach, housing mediation, homeless services, housing services, food security, capacity or technical assistance. Something else that's missing on here is public benefit navigators. Those are all very clearly eligible costs within what ARPA says, but there are ways to, connect the dots to other services. So we believe that this is going to be an open RFP and folks will be able to apply. And, we're trying to get the word out. And, we will evaluate each proposal as to whether or not we can find a way to make it eligible. And there will be some set aside buckets. For instance, capacity building will have a bucket. And then we'll see what we can actually accomplish. We are looking at having members of the community sit on the RFP panels that we're going to be hosting for this. And if you are interested in sitting on that panel, please reach out to Claudia Albano, who is helping us to seat the panel. Next slide. And then the second RFP that we're going to be putting out is the capital development RFP. And so new affordable housing and new childcare centers are clearly eligible, but there might be other things that are eligible, and we can connect those dots if we get applications. And so this RFP is going to be released in probably June, whereas the community services RFP is hoping to be released in late March, mid to late March. So next steps. We're here tonight to take public comment. We're starting to begin our development of requests for proposals and programmatic outcomes. We're going to be rolling out each RFP separately so that we have staff capacity and time to evaluate proposals and then move on to the next one. But we do believe that we'll have the March Community Services RFP, and it will be due in mid to late April. There'll be 30 days in which folks can respond. In April and June, the small business assistance and community bank RFP will be released. And then June, July, we'll do the capital development RFP. I think it's also important to note that we're going to try and host a meeting in mid-March to late March on what it takes to contract with the county, because there's a lot of details, a lot of requirements, insurance, things like that, that make it difficult for small organizations to meet the county's contracting requirements. And so we're going to try and do a training on that mid to late March. And I think that's it. And we're open for questions.